Are crappy referrals clogging your physio schedule? Do you find yourself facing the dilemma every time you receive a vague or inaccurate physio referral? Does this leave you searching for an effective way to manage and provide the best possible care for your patients? Well, you're on the right spot, so keep watching. We'll tackle this together. After 30 years of physio, I've learned some practical strategies to tackle these challenges of crappy referrals head on. To start, we need to understand what I mean by crappy. Then, I've got a practical and effective advice to navigate these tough situations. And let's face it, who doesn't get into these tough situations sometimes? If you stick around to the end, I've got some bonus content to share, a solid physio approach that will help you make the most of every patient interaction, no matter who walks through your door. So turn that frown upside down. Let's get on with this. Section 1, the physio's dilemma, making sense of crappy referrals. Here are some real referrals doctors have sent me. Pain, please assess, patient falling, or improved stroke, or generalized aches. I had one doctor who referred all his back pain patients as myositis. These kinds of referrals can be a bit of a faff, especially when patients themselves are unclear about what's going on. Some doctors might be unclear about what physios can do. Do hand patients go to physio or to occupational therapy? I had a patient referred for physiotherapy for UVB, that's ultraviolet B, for a skin condition. So I sent them down the hall to dermatology. They knew exactly what to do with this guy. But I don't blame the doctors. I'm not upset. Usually these doctors don't see anything serious and they just want the patients out of their office. They trust us to be able to help these patients. Doctors are busy trying to keep people alive with their fancy tests, their pills and potion and surgery, oh my. Direct access physiotherapy can present similar challenges. Patients often come in with their own unclear and nonspecific complaints. I've had patients come to physio seeking a back adjustment because they don't have money for chiropractic. So right up front, I have a discussion about active exercises. Or there was a patient whose aunt's hairdresser said they probably had inflamed ligaments from wearing high heels, because everyone's an expert on everything nowadays. And also with the internet and AI, I've had people come in complaining about all kinds of crazy things like Huntington's chorea or Guillain-Barré syndrome or Lou Gehrig's disease. And after 30 years, I've got to tell you, I've only seen a couple of these patients. They're pretty rare. It's a real gong show when patients roll in with their Dr. Google analysis. That's why I made this video, so you have the chops to sort it all out. And also check out this other video I did with patients who see Dr. Google. That's this one here. These crappy referrals or crappy direct access patients, same difference. Now that we've had a little chuckle at what I'm calling crappy referrals, let's put on our big boy pants and go to work. Section 2, 4 steps to tame the beast of crappy referrals in physiotherapy from frustration to function. To handle these challenging physio referrals, we need a structured approach. First, rule out red flags. If your spidey sense is tingling, then listen to your gut. A few times I've sent patients to the ER, to a local clinic, because I was worried. One time I had a patient walk in complaining of low back pain, but on further questioning, she also had saddle paresthesias. So I sent her to the urgent care clinic next door. With my business card I wrote on the back, rule out cauda equina syndrome. Apparently she had an MRI right away, but they thought it was something else. But it certainly wasn't the case for my physio's knees to chest exercises or Mackenzie back extension exercises. So use a red flag checklist. Remember, healthcare is about keeping people alive. Second, subjective assessment must be focused. Some physios let their patients talk and talk and talk, and I've been accused about being a jerk sometimes. No, it's true. I don't have an hour to listen to each patient's story. Start with some brief history. Use open-ended questions to encourage the patient to describe their main concerns in their own words. But it's okay to cut them off and summarize. Ask questions like, what brings you here today? What is your biggest problem? I am less concerned about the mechanism of injury. I am more focused on functional loss and what do they need to get back to doing. Ask specific questions like, what activities are you having trouble with? Or how do you manage your daily tasks? You're on a roll. Keep it up. In physio, there is a trend to endlessly analyze patients' flawed movement. It is more important to understand their functional limitation and goals. What do they need to get back to doing? Consider using standardized tools to quantify functional abilities and activities of daily living and to track progress over time. And you don't have to use the entire tool all the time. Pick 1 or 2 questions that correspond to your patient's major complaints. Third, use a practical, efficient evaluation. Instead of an isolated shoulder eval or hip eval, I use an upper body or lower body screening eval for both sides. Even if they had an obvious wrist fracture, look at both upper extremities for comparison. So Do a lower upper body eval or lower body eval or both. Some patients need a head to toe evaluations like post motor vehicle accident or post CVA or a post fall. So this includes your typical physio eval elements like active range of motion, manual muscle testing, and a sprinkling of special tests. Plus, we need to look at function. Examples include grip strength, single leg balance time, walking speed. You can do the functional movement screen. You can do all of it or just part of it. Finally, be mindful of your physiotherapy scope of practice. If the patient's condition or needs exceed your expertise, be prepared to redirect them to the right specialist. Don't hesitate to say, I don't know, when faced with uncertainty. Instead, seek out appropriate referrals to ensure the best possible care for your patients. Not every physio can do everything for every patient all the time. You're only human, so act like it. Now that we've tackled the basics, let's move on to some bonus content. You can't choose the patients who walk in your door, but you can choose how to help them. Bonus content: patients are a mixed bag, but your physio approach should be solid. As a physio, we can't control who walks through our door, but we do have a solid approach to how to help them. We've already discussed the importance of ruling out red flags and conducting a thorough functional assessment. Well done, you're smashing it. There are two solid foundational pillars your physio must be grounded in. First, you got to simplify your diagnosis and treatment, and second, you need to have an active exercise approach to empower your patients. The first pillar here is my simplification. My approach simplifies physiodiagnosis into three broad categories: overuse, traumatic, and systemic. I go into more detail into this other video here. These simplified diagnoses provide a clear framework to guide your treatment and focus the patient education. By using simple language, patients understand their condition and what they need to do to recover. Also, I have a simplified treatment stages: first, pain management; second, recovery of motion; and finally, strength, balance, and mobility. This gives clear progression for patient care, for you, for your team, and for the patient. Clear and simple makes it easier to communicate about treatment and goals. You can add whatever fancy diagnosis you want on top of my system, but you need to start with the basics. The second pillar here is active exercise treatments. My approach to physio focuses on empowering patients through active treatments. By prioritizing pain-free exercises, patients take charge of their recovery. Active treatments can also foster the development of patient-specific home programs. Educate your patients to help themselves get better. This is a long-term self-management approach. By focusing on active exercises, we empower the patients, we reduce the fear of movement, we prevent recurrence of injury, and we decrease a long-term disability. Passive treatments like manual therapy or heat or electrical machines have a place, but they are the adjuncts to active care. They might be used to reduce pain or stiffness before exercises or for their placebo effect when not contraindicated. This ensures active participation remains the central goal of our rehab process. If the patient doesn't actively participate in their physio, then their care cannot make them better. Don't get me wrong, I've had dementia patients improve with physio because they could follow along, but they were still doing the exercises. Their bodies still got the benefit. In essence, my approach pushes patient empowerment and long-term functional outcomes through active participation, guided by a clear and simplified system for understanding and addressing their conditions. So what can we take away from all this? Crappy physio referrals don't have to derail your day or your career. Sure, it can feel like a hot mess sometimes. We've all been there, and that's why I made this video. So you'd be able to bake through the chaos into the cake of success. So keep going, you're doing great. But here's the thing, as physios, we work with everyone, regardless of their condition. Yes, I know this depends on where you work. We don't get to cherry pick our patients like some specialized programs do. We're the ones who provide care to anyone who needs it when their condition warrants it, without the regard of their ability to pay. That's what makes our job so challenging and so rewarding. So don't let those tough referrals get you down. Whether it's finding a physio fix or making a savvy redirect, you've got the skills and expertise to handle this. These referrals aren't just the end of the road, they're your training ground to become a better clinician. So I'd love to hear from you. What are some of your own experiences with crappy referrals? How do you navigate these tough situations? Share your stories and strategies in the comments. Let's learn from each other. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. It's time for another video, and this one will make you smile and unlock a world of timely updates by subscribing to my channel. Thank you.